I think the Affordable Care Act is historic. I'm a strong supporter of it. Healthcare reform, or Obamacare, ensures that 30 million Americans are added to a health coverage in this country. It guarantees young people can stay on their parents' plan until they're 26 years old, which is really important for young people that are graduating and looking for work. It closes the donut hole for seniors, making prescription drugs more affordable, and provides free preventative care for seniors. It ends the lifetime cap on insurance policies, which is really important for people dealing with chronic disease. And it ends discrimination against children who are born with pre-existing medical conditions, which is really terrifying for families to have the fear of not only having someone who has these very serious medical needs, but maybe an inability to get insurance. It ends that practice. So I think it's very good. It does a lot. It's already helping thousands of Rhode Islanders, and the Republicans in the House have committed to repealing it, and have voted, I think, 30 or so times to repeal it. I think this is historic. I think we have to implement it now and obviously be sure that it works right. But you know, quality, affordable health care is a basic necessity of life, and we should live in a country where everyone has access to quality, affordable health care. Well, the Congressional Budget Office actually says that the healthcare reform bill will actually help to reduce the deficit over time. And it does that because it invests in prevention and wellness. And the best way to reduce healthcare costs over the long term, to really bend the cost curve, is to invest in wellness and prevention and to keep people healthier. You know, some folks in Washington on the Republican side think the way that you reduce healthcare costs is you either charge people more money, or you raise the age in some of the programs and make it harder for people to access the healthcare system. That's one way to do it. I think it's the wrong way to do it. Instead, what we should be doing is covering as many Americans as we can and driving down the cost by making sure we keep people healthy, and that we educate them about prevention, and that we rely on new technologies and new medical devices and new electronic medical records, but using technology as a way to improve health outcomes and reduce costs, not making it more difficult for people to access the healthcare system.